Hello everyone, my name is Caroline Halsey and I completed this project with Annika Gunderson, Kalia Vasquez, and Morgan Miller. This project is due on April 8th, 2026 and it is for our WSSD 450.5A course. We will be discussing the knee joint / ACL tear prevention and rehabilitation. First, we have this image of typical ACL. ACL also stands for anterior cruciate ligament. On the left side, picture A shows the ACL running from the tibia to the femur. Image B shows the ACL femoral attachment with shallow and deep regions. Image C on the bottom right shows tibial attachment site from posterior, lateral, medial, and anterior views. In these two images, we have depicted torn ACLs. Tearing your ACL can lead to knee instability, pain, and reduced joint function. ACL tears are most common in young female athletes. These images on the left depict surgically reconstructed ACLs. The damaged ligament is replaced with a tendon graft. Small tunnels are drilled into the femur and tibia and filled in with a graft, which is often from the patient's hamstring or patellar tendon or a donor tendon. The graft is then secured with screws. Recovery can take up to 9 months and requires intense physical therapy. On this slide, we will be showing the origin and insertion of the ACL along with some images. The ACL originates at the medial wall of the lateral femoral condyle. The femoral condyles are the two round structures that project from the end of the femur. The ACL inserts into the middle of the intercondylar area. This is the middle rough region of the tibia. Both the anteromedial bundle, the AMB, and the posterolateral bundle, PLB, are components that the ACL is divided into. These bundles are divided by a sheath of tissue and have slightly different insertion sites. The AMB attaches more anterior and proximal to the tibia, while being tighter in flexion. The PLB inserts more posterior and distally to the tibia, while being tighter in extension. Both of these bundles are crucial for allowing rotation and maintaining stability. The top picture shows the AMB and PLB in knee extension versus knee flexion. When the knee is extended, the PLB is taut and provides stability if the tibia were to rotate. In knee flexion, the AMB becomes tighter to resist tibial translation, or preventing the tibia from sliding more forward than the femur. The picture on the right shows a cross-section view of the origin point of the ACL. This picture makes it clearer to see the two round condyles of the femur and how the ACL is coming from the middle of the structure. The picture on the bottom shows the ACL originating from the femoral condyle of the femur bone on the top, and it inserts to the middle of the tibia. Next, we will be showing you the actions of the ACL. The ACL's primary function and action is to stabilize the knee by preventing the tibia from sliding forward towards the femur. This action of the ACL, especially with activities that include running, sudden stops, or jumping. Without the ACL, the knee would not be able to support the lower body during these actions. The ACL controls the internal rotation of the tibia by tightening the ligaments to resist inward twisting of the tibia. This is an important action during movements like sharp cutting and pivoting. The ACL contributes to proprioceptive function because it contains mechanoreceptors which provide sensory feedback about the position, movement, and load of the knee. This input engages with the nervous system to coordinate muscle activity in order to maintain balance and, most importantly, prevent injuries. The ACL is also there to help restrict unnecessary straightening on the knee. This will prevent overextension injuries. In this image on the right, we have the body positioning of the back, upright and not rotated. The hips, neutral with little adduction/rotation. The knee is more flexed, less valgus. The tibial rotation is minimal, and the landing pattern has both feet in control and balanced. Here is a video depicting some strength exercises that can be super helpful in order to help prevent ACL tears, along with some recovery exercises if you were to tear your ACL.
ACL tear prevention and recovery. Preventative measures. Stretching is always so important to do before you exercise. Hip strength is correlated with ACL injuries, so strengthen them. Back squats are also really great for strength. Altitude drops help you control your landing. And single leg squats are great too. RDLs are great for hamstring and hip strength, both important to protect your knees. Lunge isometrics, along with any other isometrics, are also great. Single leg hops are another great way to help you control your landing. Always land on 2 feet. Try not to land on 1 foot. Post-surgery recovery exercises. Hip flexion is a great way to recover after an ACL tear. And so is hip abduction. Bridges are also great. It's always important to talk to your PT about recovery. Thanks for watching. Make sure to stay strong to keep your ACL safe.
It is important to note the spotting techniques that would be helpful for some of those exercises shown in the video. There are 2 exercises that strengthen your muscles to prevent ACL tears that were shown in the video. The first exercise is a back squat. Back squats can be very dangerous if not done correctly. Having an experienced spotter is important, especially when lifting heavy. In order to spot correctly, stand 2 to 3 feet behind the lifter, mirroring their movement. Place your arms under theirs to assist if they fail. If they fail, wrap your arms under their armpits to their chest/shoulders and guide them up. Do not grab the bar. This could be very dangerous. If a spotter is not present, always squat with the safety bars just below the squat depth. That is depicted here in this image with the safety bars. This person in this image is standing outside the safety bars because they have a spotter. If you are doing it alone, make sure you stand here, within the safety bars. If you are unable to complete the rep, lower the bar onto the safety bars. The second exercise depicted in the instructional video that could benefit from a spotter was a Romanian deadlift, or RDLs. A spotter is not required or necessary for this exercise, but having another person to cue proper movement can be useful, especially when first learning. In order to cue the proper movement, gently initiate the pushing of the hips backwards, keeping the back neutral. Knees should be slightly bent, like this, and the bar or dumbbells should shave along the thighs. The other movements depicted in the video do not require a spotter, but make sure to do your research on correct techniques before attempting. Your ACL is worth protecting. We wanted to note some important ACL surgery recoveries. Full recovery time is about 6 to 9 months, but many patients can walk 7 to 10 days after surgery, and that's depending on their comfort level. ACL surgery is actually an outpatient surgery, and most can go home same day. Recovery can be broken down into 5 stages. First is the commencement stage. The goal is to reduce pain and swelling while achieving full range of motion, and this encapsulates about weeks 0 to 2. Next comes the build stage. This is when physical therapists attempt to bring back knee strength and improve flexibility. Hamstring and quadricep exercises are needed and very important. This is about weeks 2 to 12. Step 3 is the advanced stage. This is when increased difficulty in exercises to build knee stability and balance are introduced. And this is weeks 12 through 16. Next is stage 4, which is the preparation stage. Normal day-to-day activities are introduced along with non-contact drills like passing a soccer ball or a volleyball. Lastly is stage 5, which is where the athlete or patient can return to full normal activities. There should be no more swelling in the knee, returned quadricep strength, and full range of motion, and this typically occurs from weeks 24 to 48. We wanted to send a special thank you to Dr. Julie Lombardi for your educational instruction and guidance. Thanks to Dan Tecci and Harper Todd for allowing us to use the Carpenter Trout facility and equipment and for giving us useful advice. We appreciate all that you do for us and the university. Here are the resources that we use for our project. We greatly appreciate all of the information that we got from these websites and these doctors that have taken the time to teach others the importance of the ACL and what it can do for you.